Hello and welcome to another sequence. Today we are going to be doing a gluteal style sequence, focusing on rehabilitation and length through the hips and glutes. So this one is going to be pretty quick. I'm going to get you initially laying onto your back. If anything today feels uncomfortable or discomfort, please take this at your own pace. Ensure that you are doing whatever feels good and nice for your body. All right, laying onto your back. Feet are shoulder width apart, and I want them far enough in that you can give them a little tap with your fingertips. If they're too far away, your feet, you're going to feel it through your hamstrings. If they're too close to you, you're going to feel it through your quads. We want this to be primarily glute dominant. We're going to start with some pelvic tilts. So gently trying to imprint your spine into the ground below by pulling up through your coccyx, pulling your coccyx bone or your tailbone back, imprinting your lower spine into the ground, and just feeling a nice little stretch and release through those lower back muscles. Those muscles are actually called your quadratus lumborum. There's a whole host of different muscles through your lower back, but those ones are your main postural stabilizers. They do a lot to support you, help you move, help you rotate and twist, pull you back up from a bent over position. They just do a lot. So it's nice to give them a little bit of love to start off with. All right. After we've done a few of these ones, we're going to move straight into our little pelvic spinal articulations. So, releasing, and on your next pelvic tilt, you're going to pull your pelvis back. You're going to lift up through the hips, coming up through the lower back first, mid back, and then upper back. Holding and then releasing, upper back, mid back, lower back, sacrum, beautiful. And again, pelvic tilt up, lower back lifts, mid back next, upper back last, hold, upper back next, mid back next, lower back last, sacrum. We're going to keep doing these ones just for a little bit. You should be feeling it through your glute muscles. We hold at the top of the bridge to isometrically contract those glute muscles, a little bit of time under tension. This spinal articulation movement is good to warm up through the lower back and body as well, just to make sure we're not over pressing, we're not overextending, we're not hyper arching the back or anything. We're just moving sequentially. Should feel almost like a little bit of a massage. Good, we've got 3 more here. You're doing great. Keep going for another 2. Good. 1 more. Excellent. Coming back down, I want you to put all of your weight into your heels. So your toes could almost come up if they wanted to. Keep them down for stability, but putting all of your weight through your heels so you can almost, give your toes like a little bit of a wriggle around and there's no weight through them. We're going to come straight into a pelvic press now. So we're taking that spinal articulation out of it and we're just coming straight up with a flat back. Now pressing your heels down into the ground is going to put most of the weight and resistance through your glutes, which is what we want. So keep your weight through your heels, ensuring that your hips aren't doing the salsa as you come up. Imagine you've got 2 headlights on your hips and they have to point to the sky the whole time. If you put the weight through one heel more than the other, those headlights are going to teeter around, and we want to imagine them strong and direct to the sky. You're doing really well here. We're going to keep going for another 4. Another 3. Another 2. And then 1 more. And then we're going to come straight down onto the table, onto the ground. Good job. And rest there. Take a deep breath in and out. And we're going to go straight into those pelvic presses again for another set. Coming up,
Heels are where all of our weight predominantly is. If we want to, we can wriggle our toes just to ensure that we're not pushing into the toes. Again, you'll feel this more through like the quads and the hamstrings if you're putting more of the weight through different aspects of the body. So I encourage you to remain super strong through those heels and to make sure that those glutes are lifting nice and high. We're going to come up into the next one and we're going to hold it for 3 seconds, really tensing through those glutes. 3, 2, 1, and then come back down. Beautiful. And again, up. 3, 2, 1, back down. If you get pain at the top here, you are overarching your back and you're pulling your glutes too far up to the sky. Your glutes should almost come as a parallel line. So from your knees down, they're not overarching. You're going to feel that into your lower back straight away. We're just going back into that neutral, pulling up through the glutes, but not overextending through the back. Good. If you don't know what I mean, give it a go. Pull into that extension once and you'll see what I mean. And then you'll have that direct feedback as to what not to do next time. So you're just wanting to pull up, hold for 3, 2, 1, and then back down. So that little bit of time under tension is really going to make those glutes work, especially if you're pushing in through the heels, as we discussed earlier. You're doing really well here. We've only got 3 more here, and then we're going to move on to our side. 3, 2, 1. And one more. Make her a goodie. 3, 2, and 1. Beautiful work, back down. Okay, we're going to come onto our side here. So if you need a pillow, a roll-up towel, something for a little bit of extra support for your neck, more than welcome to. Otherwise, you can hold your head, you can let it come down lower, whatever works for you. I'm personally going to lower mine just because I want to. Okay, your bottom knee is going to be just in front of you. Hips are squared off. I want you to push down your fist, or you can go into an extension position with your heel of your hand. I prefer fist just because my wrists get quite sore, so fist takes that soreness away. This is to ensure that you're not pulling or pushing or rolling backwards or forward with your pelvis. So coming to that sideline position, your top leg is going to go long. Now, it's not going to go in front of you. It's not going to go behind you. It's going to just come to a comfortable neutral position. Now, I'm going to get you to lift your leg up, but I want you to really focus on where the lift is coming from. We are primarily working in this glute, the side of the glute here. So imagine that this muscle is contracting that leg and is pulling the leg up to the sky, and then it's relaxing back down. The weight and the pull is not coming from your foot or from the outside of your leg, it's coming from your glute. So, in saying that, let's get going. Fist comes in front, stabilizing. The lower leg is stabilizing as well. Tensing through that outer glute. Our foot is at neutral. We're not pointing toes to the shins, and we're not pointing top toes to the door or the other side of the room. Neutral. Now, gently lift and contract up through that top glute and then back down. Good. And again, top glute is lifting it up and over. And then it's coming back down. Good. And again. And back down. Now that we've done 3 of these, now I want you to move your toes. If you get pain in this position, if it's not feeling like it's working that top glute and that top part of the leg, now we're going to move our feet to find a position that does. So you're going to point your toes now. Now lift. You might find that pointing the toes contracts the right muscles for you to ensure you're getting the feeling of the lift through the top glute. If that doesn't work, again, we're going to change the position of the feet. You're going to bring your toes towards your shin now, and now lifting. Again, you might find that that is more beneficial for that top glute to feel like it's getting worked. Or you might want to come back to that neutral position with your toes. This is all about feeling what works for you and your hips. If you've got osteoarthritis, bursitis, syndesmosis, inflammation, tendinopathies, issues in your hips that cause you to not be able to move, I want you to try and find positions in your body that allow you to work around the pain, not through the pain. You're doing really good here. We're going to keep going. You're going to go for 3 more. I know, it's getting sore. Good job. For 2. And for 1. Excellent. You're going to bring your heels together, knees together. Now we're going to use the posterior portion of our bum and we're going to burn out through that now. So the same plane of movement, same mindset. You want to make sure that this bum is lifting, not the knees, not the heels. And we're making sure that our hips are nice and stable. You're going to raise that top knee up, keeping the ankles together. And then back down. Beautiful. And again. And back down. If this is too uncomfortable for you, you can leave this out. Good job. Back down. We're just going to go for 3 more here, nice and quick. 2. Beautiful. And last one. Excellent. And back down. You're right, we're going to turn around to the other side. So, coming onto your other side. Again, head comes under wherever you're comfortable. Fist position. I'm actually going to move this way so then you can see me. Good. Fist position to stabilize the pelvis. Bottom leg comes under, top leg comes neutral. Neutral foot, raising up, making sure that glute is doing the work first. Good. Now, I didn't say earlier, but you want to make sure here that you're not overarching into your obliques. So this is not about how high you can lift your leg. That, if you go too high, you're going to start to feel it into your obliques and into the side of the body. If we say come up here, you'll see this contracts. We don't want that to contract right now. All we're doing is working that top glute muscle. So we're trying to ensure that we're focusing on form rather than height. I only want you to get to a position where you can feel that top glute switch on and contract. Great, you're doing awesome. Keep going. I know it burns. Should burn in a good way. If it burns in a bad way, pause, stop, reassess. Only do what your body is telling you what's natural to do and what's normal to do. You know good pain, you know bad pain. All right, we're going to point our toes. Beautiful work. We're going to go here for 3, for 2, and for 1. Good, we are not stopping. We're going to point our toes towards our shin. And we're going straight into our shin. Good. Now these movements shouldn't be something that is too difficult to kind of do for you. If that's the case, this might be something that we can work up to, these workouts. I want you to only think about the muscles getting used rather than the pain, if you can. I think that's super important to think about when you're doing exercises and you're kind of doing it in a rehabilitation style. It's very easy to think about the pain side of life and things. It's all consuming, I understand. I truly understand. I do. I see it all day, every day. Our mind is so powerful, and if you can focus on how wonderful that muscle feels, how lucky you are to have it contract and recoil, move, maneuver, it's going to be so much better for that neuromuscular connection. Good, we're going to go for 2 more. Now my foot has found its neutral position because that's the way I like it, but you take it how you want. Last one. Good, and back down. Excellent. Heels come together, knees come together. We're going straight into that little posterior glute sequence. Lifting up. Ooh, there she is. Back down. Back up. You might notice that you can't really get as wide on this one, depending on which side you are. I definitely notice that my left leg is more strong, so therefore I feel like I can't lift it as much, which sounds so silly, but I really do find that that's the way. All right, we're going to go 2 more here. I'm going to shut up. Good. Really awesome. And last one. Beautiful. Alrighty, we're going to come onto our knees for a little bit of stretch. Knees are apart, feet are together. If that's uncomfortable for you, you do not have to do this last bit of class. This is just a little bit of a decompression through those glutes. Take a deep breath in here and out. Chest is closing the gap between chest and the floor. And again, deep breath in and out. I'm going to bring my arms back, just gently extend up. Raise my arms from one side to the other side of the room, just a little twist. Good. Bring them back down. Float them back out in front of you. And then gently on your exhale, ripple and roll all the way up. Bring your mat with you, accidentally. And that's all we've got time for. Perfect. So that's all I want you to do. Just 3 super simple, easy exercises, but they're really effective. If you've got any glute or hip pain, give them a go, see how you feel, and I will see you in your next sequence. Bye.